up on the screen are the questions that they're looking for in the grant, of being able to write that narrative out. So with funding in different parts, what health inequity, well, first of all, how does everybody describe health inequity? Vonda, what would you describe? What? No, Miss Roberta, I don't want to steal your thunder.
No, I was just letting it on for Vonda. Go ahead.
Okay. Vonda, what health inequity would be at the top of your list, or multiple?
In our neighborhood?
Yeah.
I think we live in a food desert, so we need food disparity,
Good food.
good quality food. Fresh.
And I think that, this is Roberta, I think that when I have a telehealth meeting with my doctor, I don't get to see her or she see me. So I think if you're gonna have a telehealth, it needs to be one where you can at least see your doctor, or they see you, not just a telephone call, because I could tell her anything and she could tell me anything, but I don't know if what she's saying is true because I can't see her face or her expressions or any of that.
So you don't know if she's fully engaged.
Yes.
Okay. Brooke? What would you describe health inequity?
I think about engaging outdoor spaces to exercise, but also spend time with family, for any age to be able to play and run around and feel like that's a safe, inviting, engaging space to be in.
Do you feel that people feel they don't have access to it? And I'll frame that with the reason that Vive Wellness was founded, was that Latino immigrants don't even feel welcome in a rec center. Are you finding community, even though those spaces are open, that they still don't feel welcome?
That also makes me just think about problems of over policing in local parks too.
Okay, we'll just do a test recap. So Juanita, we were going over the health inequity, asking everybody in turn what we see as the health inequity that our work should address with this grant. Vonda talked about the food inequity, the lack of quality food, fresh food in the neighborhood. Roberta talked about the digital divide, the telehealth of just being a phone call that you really can't see the person, see if they're engaged, see if what they're telling you is correct. And Brooke mentioned like a inequity of people feeling safe, feeling engaged with outdoor spaces, that over policing can be a result. Is translation working better for you, Juanita?
Sí, se escucha mucho mejor, gracias.
Great. Okay, Brooke, on the outdoor spaces and inequity, anything else on that?
Well, you had posed a question too about feeling welcome in rec centers as well. So I don't want to speak for others or other communities and how they're feeling, but I guess I would be more curious to know, where are people in the community feeling like they have spaces that they can go to recreate, exercise, have picnics with their family, run around and play, and are those spaces feeling adequate and equitable and fun and accessible?
Okay. We have, welcome, Ana Luisa.
Hola a todos. No, se me corta a mí el internet, pero es mi computadora, no son ustedes. No sé, tengo problemas desde la mañana un poco con el internet, pero sí los escucho. Los escucho.
Good, good. So we're going through right now just questions of what we define individually of health inequity that we might see in the community. Vonda's identified food insecurity and equity. Roberta, telehealth, digital inequity now with the doctor just doing a phone call. Brooke was kind of access to outdoor spaces, people feeling safe and sometimes the over policing, but also an inequity of maybe people not feeling them welcome in spaces where they used to be. Maybe, you know, it might be a question of being pushed out of spaces. Juanita, what would you describe maybe as one of the top health inequities you see in the community?
Creo que varía, pienso, nosotros en la comunidad como hispanos, pues recurrimos a centros de ayuda de comida y pues creo que tengo la opinión similar a que no es tan buena calidad de comida, no es la mejor que nos ofrecen, pero tenemos ese tipo de comida, entonces siento que no hay igualdad en nuestra comunidad.
No equality. Okay. Carla?
So I think when we talk about health equity, I think about like everything that like a person needs, right? So like, you know, we talked about the mental health, the physical health, the food sources, but also like the financial, right? We know that there's a lot of people in our community who are having to make the choice of leaving the community because they can no longer afford to live in the community. And sometimes it is because we have like the nicer stores or the nicer this, or, you know, that it seems like that's what also helps push people away. And so, you know, that's just like an observation and what I just think it's a little bit interesting. So I'm not quite sure exactly like what I would, you know, what I would define exactly as like specifically, because I just think that there's like so many things, even like within education, right? Are our kids getting the adequate education for them to be healthy in the future? And also, you know, even in the lunchroom, do they get adequate food? Are they able to stay in the neighborhood and feel safe? You know, so I think there's a lot that goes with this question. So I'm not really sure how to answer it other than just think about like all of the, you know, the health needs, right? And all of the things that we need in order to stay healthy. I don't think it's just like one thing or the other, but is the purpose of this to stick to one specific, like you said, you know, it was community who's going to decide. So then in this case, has community decided, and is it food? Are we still doing food, or is it?
We're deciding.
Okay.
So right now we're getting everybody's input
Got it.
before we decide and where we move through. And these all guide into a next level.
Okay.
And they are really totally interwoven the way that, in my mind, I see it. You know, but
Yeah.
that's always a quagmire inside of that. Ana Luisa, what would you define as a health inequity?
Pues en cierta forma, pues lo que han dicho las compañeras, en realidad, pues yo creo que todos nos basamos a como dijeron, o sea, que las que hemos recibido alimentos se ha visto que no hay una igualdad para todos igual. De alguna otra forma, cuando también es cuestión de ayuda económica, no sé, en ese sentido también pienso que ven más a las personas que a veces cuando realmente uno necesita esa ayuda económica, o sea, no la obtiene uno, y no sé por qué, si es por la raza o porque de alguna manera pues no sabemos buscar bien esa ayuda. Entonces, de alguna manera pienso que ahí es donde vemos que hay desigualdad. Y como decimos, no sé si tenga también que ver también el aspecto en el que nos puedan ver físicamente. Eso también pienso que tiene mucho que ver, el cómo ven a una persona en la forma de cómo se desarrolla o cómo se viste. Y a mí se me hace eso desigualdad. Para mí viene siendo eso más desigualdad. Como, sí, de alguna manera eso es para mí. No sé si necesito decir un poquito más, pero sí estoy pensando en todo lo que se ha hablado, y hay mucha desigualdad en muchas cosas.
No, I completely agree on everything of what we're looking at. And a lot of it of what I think, really is a lot of times what I write to with Colorado Health Foundation is economic inequity, lack of resources, being pushed out, being educated, knowing how to access them. And I think what you identified too, Ana Luisa, is, what's been really evident with the pandemic and the different part is how we're getting information to people. And unless you know how to use a computer and email like I do, it's going to take a while for the information to get there, because we're not empowering community voice to be able to come and explain what we're doing. We think a lot of the outreach of, hey, we shared it, we posted it here. Well, you should have that, and that's an inequity. And that inequity really, it shines through exactly of what y'all were saying, truly about like food inequity, of access to it, of access to quality, affordable food. When Montbello, being a food desert, the only market that would come out there was Save-A-Lot. And that's kind of like a for sale, to me, food pantry of the Rockies, where you don't get the fresh food, you get it stale, on a different level. And we're starting to see some of the food banks of really being able to engage and purchase more fresh food on different levels. And definitely, Roberta, what you identified too of this growing inequity on health. The health inequity, the different level of how people are treated, of truly of it being just a phone call is just kind of a checkoff list, and where that grows through where you're able to actually see people. One of the huge health inequities that, is, how African-American women are treated by the medical profession, of thinking that, you have a higher level for pain, that you don't need medication, that, oh, you're just going to abuse that on a different level. A friend of mine, Cynthia Ware, that activist in coal in different parts, all throughout the pandemic, thought she had COVID, her lungs were weak, the different parts. She'd been going to National Jewish of a different level, and they never called her in and did a chest scan. And then when they finally did a listening of, she's been saying this for 6 to 9 months, it's like, oh, you have stage 4 lung cancer. And it's like, that makes no sense. You call in and did that scan and you find that before it goes into that. But yeah, the health inequities, this digital divide and the economic and really the supply part, and really, Ana Luisa, the truth of, how people, you're saying how people present, how they look. of a classism, of a different kind of part, of that's feeling pushed out and not welcome in the community. So, I mean, a lot of how I'm seeing all this really ties in is just this wealth inequity. And this wealth inequity that comes in and people, you know, flipping their houses, paying more and more of like really doubled like property tax. 10 years ago, property tax in a house in Cole was probably like $700-800. Now it's, well over probably 1,000 or 2,000 in that communication. And we're going to come back to activities, but maybe of summing that up of, I think all the health inequities that we identified are what we're looking to address. Food, health, and definitely, Carla, the mental of where it is. But if your financial health isn't stable, everything else falls apart in our economy. And it all ties into that on a level. And it's the communication and clarity that really flow through. So we're going to, what activities